Let us start our discussion on femoral artery. It's the chief artery of the lower limb. Okay, so first we'll understand its origin. It is actually a continuation of external iliac artery. Actually, at this position you can find the inguinal ligament. Inguinal ligament start from anterior superior iliac spine and it extends up to the pubic tubercle. So that is the inguinal ligament. So above inguinal ligament you will find the external iliac external iliac artery. That external iliac artery only below the inguinal ligament, it is called as femoral artery. Okay, so this femoral artery origin is from below the, or you can say behind the inguinal ligament at the mid inguinal point here. So you can see here the mid inguinal point. So here it's the origin of the femoral artery. So let us see the surface marking of the femoral ring and femoral artery. The femoral ring is nothing but the representation of horizontal line over the inguinal ligament medial to the mid inguinal point. So you can see this is mid inguinal point, so medial to it. At this site you can find out the femoral ring. Next, coming to femoral artery, it is of course represented by upper 2/3 of the line which is joining the mid inguinal point to the adductor tubercle till here. Okay, so the thigh is actually slightly flexed. You can see in this diagram the thigh is slightly flexed. Abducted means away from body, adduction means towards the body. You can see this is the medial side, right? I am drawing an imaginary line. This is the medial side. If the thigh is coming towards this side, that is called adduction. As now the thigh is going away from the medial line, that is called abduction. So here the thigh is abducted, flexed, and also laterally rotated. Of course, abduction means laterally rotated. If adduction means medially rotated. Okay, so this is about the surface marking of the femoral artery, right? Now we'll understand the extent and course of femoral artery. It passes downward medially first in the femoral triangle. So first I will draw an imaginary line of the femoral triangle. So femoral triangle actually will be at this area like this. Okay, so this is the base of the triangle, right? This is the base and this is the apex of the triangle. Okay, this is how the femoral triangle is there. So this femoral artery, you can see it is a part of the content of the femoral triangle. It passes downward and also it passes medially. So first in the femoral triangle and then in the adductor canal. So first it passes in the femoral triangle, later it passes in the adductor canal. Adductor canal will be somewhere over here. I will discuss about that in next further videos. Okay, so it passes into the adductor canal, and at the lower end of adductor canal, that is at the junction of middle and lower thirds of thigh, it passes through an opening into adductor magnus. Later it passes, here will be adductor magnus muscle, so it pierces that muscle and passes into it to become continuous with the popliteal artery. So like this femoral artery will go and go like this. So you can see this side, this is called as popliteal fossa. So here it passes as a popliteal. As now it has come to this place, this is called as popliteal artery. So the artery is the same, but the name is changing. If the artery is above the inguinal ligament, it is called external iliac artery, right? Because here ilium bone. Okay, so like that you can remember external iliac artery. As the artery is coming to the femoral region, that is the thigh region, so below the inguinal ligament, it is called femoral artery. Now as this femoral artery is going to the popliteal region, so now it is called as popliteal artery. So according to the region, the name is changing. So this diagram is perfect to see the popliteal artery. You can see here, as I said, first it is passing in the triangle and later it is passing in the adductor canal, it's mentioned here, and later it's opening tendinous opening in adductor magnus. As I said, it will pass by adductor magnus, finally it will reach the popliteal region. Always remember, popliteal region is on the posterior side, hence they are drawn like in dotted line. So this is the popliteal artery. So you can see this is a posterior side, this is the anterior side of the thigh, this is a posterior side, right? So here it reaches. So this is the extent and course of the femoral artery. Now let us see the relations of the femoral artery, like what are present around that. So this diagram is perfect to find out the relations of femoral artery. So the main anterior relation. So first we need to see where is the femoral artery here. This one, right? So the first anterior relation is of course the skin. You will have the skin outside. After that you will have the superficial fascia. After the superficial fascia you will have the deep fascia, and after that you will have the anterior wall of femoral sheet, right? Because femoral sheet, you can see here this green dotted line, this is the femoral sheet. Actually femoral sheet encloses the artery, vein and also the lymph nodes, but it will not accompany the nerve, right? So This is a femoral sheath. So all the structures are anterior, like skin, superficial fascia, deep fascia, femoral sheath. Okay, and posterior to the artery, you will find from above downwards. First, you will have the psoas major muscle. So you can see here this is a psoas tendon of psoas major muscle, and from above downwards I'm saying, so above first you have this. Next you will have the pectineus muscle, you can see. After the pectineus you will have the adductor longus. So this is adductor longus. After that you will have the posterior wall of femoral sheath. So this is the posterior wall of femoral sheath that intervenes between these structures and artery. So between artery and these structures you will have the posterior wall of the femoral sheath. Okay, so anteriorly you have skin, superficial fascia, deep fascia, anterior femoral sheath. Posteriorly from above downwards you have different muscles like psoas major muscle. Next you have the pectineus muscle. Next you have the adductor longus muscle, and finally you have the posterior wall of the femoral sheath. So femoral artery is also accompanied by femoral vein. You can see just side to it. This is a femoral vein, right? So just below the inguinal ligament, the vein is medial to the artery. However, the vein gradually crosses the lateral side posterior to the artery, and it is directly behind the artery at the apex of femoral triangle. So let us understand this sentence. Femoral artery is always accompanied by femoral vein. Okay, so just below the inguinal ligament, for example here will be inguinal ligament, so just below the inguinal ligament, this diagram is clear for it. This is inguinal ligament. So just below the inguinal ligament, the vein is medial to artery. This is medial side, right? So femoral vein is medial to femoral artery. Okay, however the vein gradually crosses the lateral side posterior to the artery, right? So if you see the vein, it is passing posterior to our femoral artery, right? And it is also passing to the lateral side. So it is directly behind the artery at the apex of femoral triangle. So at the apex of femoral triangle, if you observe, the femoral vein will be posterior to the femoral artery and lateral to the lower end of artery. So you can see lateral to the lower end of it. Lower end it is lateral. So in the beginning it is medial, at the lower end it is lateral to the femoral artery. So now coming to the femoral nerve. Femoral nerve is here in this diagram. You can see it's the lateral most to the upper part of artery. The lower down the artery is related to branches of the nerve, some of which cross it, and the branch of pectineus crosses behind the upper part of artery. The medial cutaneous nerve of thigh crosses the artery from lateral to medial side near the apex of femoral triangle. Next, the saphenous branch crosses the artery within the adductor canal, and the nerve to vastus medialis is lateral to artery and adductor canal. So these are different branches of the artery which are in relation to the femoral artery. Now coming to the femoral branch of genitofemoral nerve. I will show that branch. So here you can see the femoral branch of genitofemoral nerve. This is also lateral to upper part of femoral artery, and within the femoral sheath, but lower down it passes into front of artery. Next come into the profunda femoris artery, which is a branch of femoral artery. So profunda femoris artery. So in this diagram you can see this is the profunda femoris. So profunda femoris artery is a branch of femoral artery itself, and it is a companion vein lie behind upper part of femoral artery. It lies mainly on the pectineus muscle and lower down. However, the femoral profunda arteries are separated by the adductor longus muscle on this side. Okay, so the relations of femoral artery and adductor canal are given. We'll see in adductor canal later. So next we'll discuss about the branches in the femoral triangle. So femoral artery in the femoral triangle mainly gives 3 superficial branches and 3 deep branches. So the superficial branches are superficial epigastric artery, superficial circumflex iliac artery, superficial external pudendal artery. So these are the 3 superficial branches. So the 3 deep arteries of femoral artery are deep external pudendal, profunda femoris artery, and you have the muscular arteries. So these are the 3 deep branches and 3 superficial branches of femoral artery. So these are the branches. So now we'll discuss some more detail of the profunda femoris artery. So if you see here, this is the profunda femoris artery. The profunda femoris is the largest branch of femoral artery, and it is the chief artery to supply to all 3 compartments of thigh. It mainly arises from the lateral side of femoral artery. You can see this is a femoral artery. From lateral side it arises, right? So from the lateral side it arises below inguinal ligament, and the origin lies in front of iliacus. Here will be the iliac muscle on the back side. So from front of iliacus it starts, okay, and yeah, as the artery descends, it passes posterior to femoral vessel. It leaves a femoral triangle by passing deep to adductor longus. Continue downward, passes first between the adductor longus and brevis. So it passes between adductor longus and brevis muscle, and then between adductor longus and adductor magnus. Its terminal part pierces the adductor magnus to anastomose with upper muscular parts or branches of popliteal artery. So here from the back side, posterior side, the popliteal arteries will come and they will anastomose with this profunda femoris artery. Okay, so remember it first passes between adductor longus, adductor brevis. Next it passes between adductor longus and adductor magnus. Later it anastomoses with the popliteal arteries. Okay. So next coming to profunda femoris artery, which gives off a medial and lateral circumflex artery. So this profunda breakers in turn gives the medial and lateral circumflex arteries. Okay, and it also gives 4 perforating arteries. The medial circumflex femoral artery. So we can see here the median descending branch of median circumflex femoral artery, which is in turn coming from the branches of median circumflex femoral. You can see here this artery, right? Profunda femoris artery gives medial and lateral circumflex femoral artery, right? As I said, this medial circumflex femoral artery leaves a femoral triangle, pass posteriorly between pectineus and psoas major muscle, and you can see this, it has come near to the adductor canal, right? Next coming to lateral circumflex artery, you can see here the ascending transverse descending branches of lateral circumflex femoral artery. So this lateral circumflex artery runs laterally between anterior and posterior division of rectus femoris, right? Anterior and posterior division of femoral nerve, sorry. It runs between the anterior and posterior division of femoral nerve, passes behind sartorius and rectus femoris, divides into ascending, transverse, descending branches. You can see all these names here, right? So the ascending branch runs deep to tensor fascia lata, give branches to hip joint, greater trochanter, anastomose with superior gluteal artery. The transverse branch pierces vastus lateralis and takes part in cruciate anastomose on back of thigh, just below greater trochanter, and a descending branch runs down along anterior border of vastus lateralis, and it is accompanied by nerve to that muscle. And also there are perforating arteries, as you can see mentioned here, 4 perforating branches. So next we'll discuss about deep external pudendal artery. So if you see the deep external pudendal artery, it's a branch of femoral artery, pass deep to the spermatic cord or the round ligament of uterus, and it supplies the scrotum or the labium majus. Okay, scrotum in the case of male, labium majus in the case of female. So next coming to the muscular branches, you can see here these are numerous and arise from femoral and also profunda femoris artery. So let us also discuss a clinical anatomy related to this branches of femoral artery and also femoral artery. So femoral artery can be compressed at mid-inguinal point. So here's the mid-inguinal point. So at this point there is a chance of compression of femoral artery, okay, against the head of femur or against the superior ramus of pubis to control bleeding from distal part of limb. So pulsations of femoral artery can be felt in the mid-inguinal point against the head of femur and the tendon of psoas major. So bilateral absence of feebleness of femoral pulse may result from coarctation or narrowing of aorta or thrombosis of abdominal aorta, right? So clotting of blood within the aorta. All these conditions may lead to some different abnormal pulsations in the femoral artery. So stab wounds at the apex of femoral triangle. If you have stab wounds at apex of femoral triangle, femoral triangle apex will be here. So if there are any wounds over here, They may cut large vessels of lower limb because of femoral artery and vein. Profunda femoris artery and vein arranged in line before backwards at this side. So since femoral artery is quite superficial in femoral triangle, it can be easily exposed for ligation. Okay, so that is tying or for passing a cannula or thick needle. All those can be done in the femoral. So next we'll start with the femoral vein.